Welcome, everyone. We'll get started here in just a bit. All right, I think we can go ahead and get started. It's 11:02. My name's Amanda Smith. I'm the project manager for the Dollars to Digitize grant program. I work for the Office of eHealth Innovation. You'll also be hearing from Sierra Childs today. She is our project coordinator and also the technical assistance provider for the grant program. Before we dive into the presentation today, I just wanted to make sure everyone was aware that you have various ways you can interact with the webinar. So first, we have Zoom Q&A. This function allows you to submit questions to us and receive answers in real time provided by our webinar support from the Colorado Health Institute. So we have Nina, Chrissy, Alex, and Paul available to answer your questions in real time using Zoom Q&A. In addition to that, we also have a traditional Zoom chat box, which you'll notice in the bottom right-hand corner. You can use this space to add some thoughts or give feedback, but just know that if you put a question in there, it will not be responded to. If you have a question, we'd invite you to use Zoom Q&A, and we will do our very best to answer everyone's questions. Also, we'll have time for live questions at the end of the presentation today. And we want to thank you all who submitted questions through the Zoom registration. We updated our FAQs document located on the website to address those questions. And finally, you should know that today's webinar is recorded and will be posted on the ARPA website. All right, so here's a chance to use the chat. We want to hear from you. We're really curious to know what are you most interested in hearing about today? So in a few words, if you could use the chat, please share with us what interests you the most. And we hope to get to as many of these as possible. Just know when you do use the chat, we ask that you just make sure that the default is on all attendees and panelists before you send your message so that we can see it. And while everyone's using the chat, I will go ahead and dive into today's presentation, and thank you all for, I see some responses are coming in. All right, so what is the Dollars to Digitize ARPA 606 grant program? Well, it's $18 million in American Rescue Plan Act funding available to Health First Colorado enrolled HCBS and behavioral health providers in Colorado. This funding is meant for providers to enhance, strengthen, and improve their services through digital technology, enhancing their organization's EHR system or upgrades. And the total investment is $18 million. However, individual organizations are eligible to request up to $500,000 in funding. Please know that individual organizations would be submitting one application. So if you're an organization that provides both behavioral health services and HCBS, we invite you to submit one application. Similarly, if your organization has multiple sites or locations, one application to be submitted. And you should also know that even though the maximum award amount is up to $500,000, there are additional maximums per expense categories. So, for example, An EHR upgrade or implementation would have a maximum recommended amount to request of $300,000. However, if you have technical assistance or other expenses you wish to request, it cannot exceed $500,000. Okay, so let's start with a quick poll today. We're really curious to know who's with us. So you might have just noticed a little pop-up here. If you could go ahead and select the option that best describes your organization, we'd really appreciate that and would like to know who's with us, joining us today. And so while the poll is being conducted, I'll keep moving forward to talk about the eligibility for the Dollars to Digitize grant program. So we have two types of providers who are eligible to apply for funding. So the first is HCBS providers in Colorado who are Medicaid enrolled or Health First Colorado enrolled providers who are actively billing Medicaid for services provided to two or more persons on an HCBS waiver. And so just to be clear what it means actively billing Medicaid, we're actually using Medicaid claims and billing data to verify eligibility. And we're looking at the time frame of August 1st of 2021 to August 31st of 2022. So 12 months, if you're an HCBS provider enrolled in Colorado Medicaid and you've provided services to two or more HCBS waiver clients, you're eligible. The next provider type who's eligible for Dollars to Digitize are behavioral health providers in Colorado. Again, it's for the past 12 months actively billing Medicaid. However, for behavioral health providers, we're looking for those providers who have served 30 or more Health First Colorado members. And so I also wanted to say real quick, let me just take a quick look at our poll real quick. Wow, great. We have a lot of HCBS providers and behavioral health providers on here. We're so glad you guys are here. Thank you for participating in our poll. I also just wanted to quickly acknowledge that we will be having another grant application period this summer. So if you're interested in this grant opportunity, but maybe your organization's not ready for a digital transformation project, we'd invite you to check back with us in the summertime, where we will also be expanding eligibility to other providers. And so we're really excited about the summer grant application period, but for the fall, we have narrowed our scope to include these two provider types. And before applying, it may be useful for your organization to consider just how this awesome grant opportunity could benefit your organization. We've put together a few suggestions of things to think about. Will this organization help you reach more clients and perhaps in new communities? Will you be more efficient and financially viable with an upgraded EHR system or electronic billing system? Will you be able to attract and retain more providers and staff? And can you offer higher quality of care and service for members? So we're really excited about the potential for these improved outcomes as a consequence of providers taking advantage of this great grant opportunity using ARPA dollars. All right, so how much funding will you receive? Well, we talked about the maximum grant award per organization or grantee is up to $500,000, and you get to decide how much your organization needs. We'll talk about the application process, but you should know that the full application, which opens November 1st, will include a detailed budget plan where you will be sharing with us how exactly you intend to spend these funds. And you should also know that the way the grant is structured is on a cost reimbursement basis. So what does that mean? If you're an organization applying for this grant and you have a digital transformation project in mind, you will be responsible for the upfront funds to start and implement your project. And then when you receive an invoice from your vendor, your technology vendor, you would submit that to the department's financial agent, who will be reimbursing you within 45 to 60 days. That's our estimate for the expenses incurred. This does not include reimbursement for any expenses occurred prior to a grant award agreement. We'll be talking about that a little bit more as well. And if you're concerned about the budget request, we will have technical assistance available to assist you with that. Now I'll pause for some questions. I'm looking to Team CHI. Have we received any questions from the audience today regarding eligibility?
Yes, Amanda. So we have a question from the audience asking, does a provider need to be providing services for the entire 12 months or just provided services at some point within the 12-month time frame?
That's a great question. Thanks, Chrissy. So the way our grant is designed is for within the past 12 months, depending on if you're a behavioral health provider, 30 or more, or HCBS, 2 or more. If you have reached that criteria with it 6 months before or a full year, as long as you reach those thresholds defined for our eligibility criteria, you are conditionally approved to apply.
Thanks, Amanda. Another question about eligibility. Can you say more about single entry points and if they are eligible for this grant?
Yes, that's a great question. So in working with the department and in lieu of the CMA redesign, we are targeting having the CMAs join the digital Dollars to Digitize grant in the summer. So currently, if you're a care management agency or a SEP or CCB, and you're interested in this grant, we would invite you to apply in the summer, which will align with the redesign, and it will be open to all CMAs. I will say, if you're a SEP or CCB and after the redesign, you are not participating in the conflict-free services, say you become an HCBS provider, direct services, you're eligible for this grant just like all other HCBS providers will be. If you continue in the redesign, you'll also be eligible, but only for the EHR upgrades or implementations. And that's because the department has other grant opportunities using ARPA funds that you can take advantage of as well. Thank you for that question.
Last live question, Amanda, for this. There's an organization that is both an HCBS provider and a case management agency. How should they think about applying for this grant?
Yeah, that's a great question. So again, the feedback from the department is that if you're providing services as a case management agency, even if you're today providing HCBS services, we are going to invite you to apply in the summer application. There will be plenty of funding for those provider types. But again, due to the CMA redesign, we are not including them for this fall application period. And with that, I think we're ready to move on to allowable expenses. And just as a reminder, if you're using the chat to share questions, we thank you for those questions, but we will not be able to answer those on the call today. We'd invite you to check back on our FAQs. But if you want your question answered in real time, remember we have the Zoom Q&A available to you, and Team CHI is on point to answer those questions. Now, before we dive into allowable expenses, what can we purchase with these ARPA dollars? We want to provide some perspective that this funding really is meant to invest in digital tools and technology for providers who weren't included in the Meaningful Use EHR incentive program before. And we really want to use these funds to enhance digital transformation initiatives like care coordination, interoperability, with the ultimate goal of strengthening, enhancing, improving digital tools used by HCBS and behavioral health providers. So with that in mind, we do have 7 different allowable expense categories you'll see on the screen here. Eligible for purchase is telehealth systems, devices and equipment, which by the way is still pending federal approval, devices and equipment, new or enhanced electronic systems, connection to the statewide health and social information, so referral network platforms, technical support, we again HIE to the other point there, and obviously indirect and administrative expenses are included. Please know that when the budget plan is submitted, that any funds not spent according to these allowable categories or spent in the time frame for ARPA funds, which by the way, everything has to be spent down by September of 2024. So September of 2024, If it's not spent or on an allowable category, those funds will be forfeited. So we do encourage you all to work with your vendors on this timeline, as well as with understanding again that the providers will need to upfront the costs of these expenses to be reimbursed by the department. So please plan ahead and work with your vendors accordingly. So we'll dive in a little bit deeper to some of these expense categories. And so for new and enhanced electronic systems, actually, I'm going to pause. We have another poll here. We'd like to know in the chat box here, what digital transformations are you hoping to pursue with these grant funds? And I'm personally really excited to see the responses to these. Getting some great feedback here. I also just want to acknowledge and thank those of you who participated in our digital tools and technology survey. We did read every response, and we did take this really insightful feedback and apply it to our thinking as we designed this grant program to have the highest impact and meet the most need. Great. All right, and so while the poll is still going, and we'll see the results here in a little bit, will give us just 3 more seconds here. All right. So as you can see, we have 36% are interested in a paper conversion to an electronic system. Wow, that's awesome. 68% an electronic, enhanced electronic system, 30% telehealth, 77% for devices and equipment. HIE, social information networks, 30% of you are interested in that, as well as 36% are interested in technical assistance. And as the last one says, hey, if you have another idea that you're interested in, go ahead and put that in the chat. Thank you all for participating in that poll. Okay, so electronic systems, these would include your electronic health records, electronic billing systems, other software that would directly support your members, as well as interoperability, care coordination. So we're thinking client management systems. We're even thinking if you're on paper today and it makes sense for your organization to use Microsoft Office or QuickBooks, that would also be an allowable expense. Moving on to telehealth. That is also an allowable expense, including the devices necessary to deliver telehealth services. You'll notice in the devices and expense category that there's a little asterisk there. That's because these ARPA dollars, the state of Colorado wants to invest in HCBS and behavioral health providers for their digital tools and technology needs, but that does need to go to the to CMS for approval, conditional approval to move forward. And we are waiting and pending the approval to move forward with devices. We hope to know here within a couple of weeks. We're very optimistic about the decision here, but just be aware that that's pending federal authority approval. We also have a connection to statewide health social information networks. This would include your connection to the health information exchanges like Contexture, formerly Creo, QHN, CCMCN, or other statewide health and social data sharing platforms, also referral network platforms as well. And technical assistance, obviously, a lot of the feedback we received from our survey indicated that a lot of you would like to start on a digital transformation journey, but you just don't have the technical resources available to assist with implementing the configuration steps, user management, training. So there is funding available for your technical assistance needs. And this grant allows for up to 10% of the total grant award amount to go towards indirect expenses. And next we'll move on to what's not allowed. Sometimes that can be just as valuable. We've received a lot of questions on this, and I think we will probably get a few more questions about allowable expenses. So we definitely invite you to use the Q&A today if you'd like a response, but we're going to do our very best to get to all of those questions as much as possible today. However, please visit our website, please email us your questions, and we would be happy to look into that for you and get you a response. However, and we'll talk about this in a minute, we can't respond individually one-on-one to inquiries of a specific nature. So we will post all responses like that publicly in our FAQs. All right, so let's talk about what's not allowed because we've received a lot of feedback as mentioned. So any expenses that were incurred or made prior to a signed grant award agreement are not eligible. So if you started your EHR already, if you recently purchased computers, we cannot retroactively reimburse you those costs. And similarly, please do not start your digital transformation projects until you have a signed grant award contract. Then you can move forward with confidence knowing that it will be reimbursed. And we'll talk about that a little bit more in the presentation today. Also, ongoing costs that occur after the grant award period will not be reimbursed. So all providers in Dollars to Digitize have till September 31st of 2024 or September 30th of 2024. Devices that are not needed for digital transformation. We think about devices that would be essential for telehealth, for care coordination, for interoperability. If a device is requested that is not deemed necessary, it will not be approved. So it is advised not to request those. Any costs reimbursable through another funder, that's, for example, if there's a expense that would otherwise be covered through Medicaid, that is also not allowed under Dollars to Digitize. High-speed broadband, EVV software or hardware is not covered. Remote patient monitoring, assistive tech, things like payroll systems, all things that are not directly supporting interoperability, care coordination, and digital transformation are not included. I realize many of you probably have some questions. There's some gray areas here, but we will do our best to respond to you if you have specific questions. So again, please email us or use the Q&A, the Zoom Q&A today. And before we move on to the next segment, I just feel that maybe we could pause here to see if CHI has any questions regarding allowable expenses before we go into the application process. Okay, if there's no questions for eligible expenses, I'd love to hand it off to Sierra to present on the application process.
Yeah, hello everyone, and thanks so much for joining us today. My name is Sierra and I manage a lot of the technical assistance for this grant. So I'm going to walk through a quick overview of what the application process looks like for this opportunity. So to start off, there are a couple of different application phases. The first phase of the application process is the intent to apply form. This is already available and can be found on the ARPA 6.06 website. This is a short form. It takes approximately 20 minutes to complete, and it's meant basically as a preliminary check of basic eligibility. So the next steps of the application, such as the readiness assessment, activity assessments, and making work plans, they require a lot more information and take a lot more time and investment. So this intent to apply really helps ensure that folks who may not be eligible for this funding opportunity don't have to spend their valuable time on the full application. So the intent to apply is meant to confirm that providers are enrolled with Health First Colorado and confirm they are an eligible provider type. So that's HCBS or home and community-based services or behavioral health. So once a provider completes the intent to apply form and is found to be eligible, this acts as a pre-approval and it will ensure they receive an invitation to submit the full application when it opens on November 1st. So the intent to apply closes on November 18th, and if you complete the intent to apply form after the full application opens, so on November 1st, you're pre-approved, you'll receive your pre-approval within 5 to 7 business days. So the full application, just so you know, it includes the readiness assessment for the adoption and sustainability of the technology being requested, and it also includes budgeting information. So you'll have links to the budgeting templates and included in your pre-approval email notification. Next slide. So there's actually going to be another pop-up poll question here as I'm walking through the application process. So you can feel free to fill that out as I'm talking. But as I mentioned before, the intent to apply form opened up on October 3rd, and it will remain open until November 18th. While this is open, eligible applicants will be verified on a weekly basis and will receive their pre-approval notification inviting them to submit a full application on November 1st. So that full application actually opens up on November 1st and stays open until Friday, January 6th. Again, during that full application, eligible grantees will be asked to complete a readiness assessment and submit their full application with a detailed budget. As a reminder, budget templates will be made available in their pre-approval emails. During January and February of 2023, the templates will applications will undergo review. Depending on the volume of applications, our team is really hopeful to start sending out final approval letters at the end of February. All award letters will be sent out by April or May of 2023. Also, just wanted to point out, considering the timeline, I just want to remind everyone that grantees cannot be awarded for expenses retroactively. So please do not make purchases or sign contracts with vendors before awards have been received. For anyone who has already completed the intent to apply form, we'd also really love to get your feedback on how that process and experience was for you. In particular, I really want to know, was it easy for you to complete, and do you have any advice for people who have not yet completed it? So if you have anything to share, please feel free to put that in the chat. All right, and just looking at the poll, it looks like we have actually a lot of people who have already submitted their intent to apply forms. So that's really great to see. For those of you who have, please put your information in the chat on how that process went. Thank you. Next slide. So here, I just wanted to give a brief overview of the payment timeline. As I said before, award letters and contracts should start going out in February, and we plan on starting to send first payments in April or May. Again, awardees should not start projects until they have signed the grant award contract, because funding will not cover anything from before the signed contract is in place. I also just wanted to point out one other date for you. So the last invoices will be due to the fiscal agent by September 30th, 2024. Thanks. Next slide. So how do I get started? For providers who want to go ahead and get started applying for this opportunity, the way to get started is with that intent to apply form. That's available right now on the ARPA 6.06 website, which is here on this slide, and it takes about 20 minutes. The intent to apply will also ask you to send 2 pieces of documentation over email. So what we're looking for is your 2021 W-9 IRS tax form and your certificate of good standing from the Secretary of State. And by the way, we have received some questions about whether or not a certificate of fact is acceptable. Right now, certificate of fact is acceptable, and that should also be in our FAQ document if you have any questions about that as well. There are also instructions on the website to retrieve your certificate of good standing. So if you're having trouble tracking down that documentation, just check out our website and we have information on how to get that. It's important here also just to address that your name and address, as well as your NPI number, are all consistent on all of your documentation, and that what we receive matches up. We've also seen some other types of documents, and what we really need again is just the W-9 and their certificate of good standing. All of this is spelled out in the intent to apply, but I just want to remind you all, so we're not, tracking down documentation or anything like that. Hopefully it saves you some time as well. So additionally, you can find all of this information on the guidelines portion of our website. There should be a link to the intent to apply in the chat as well, if you wanted to pull that up just to take a look at it. It's mostly asking for basic information like what I mentioned before. That's your name, address, a point of contact for the application, your employer tax number, and your Health First Colorado ID. The link to the Colorado Secretary of State website should also be available in the chat if you wanted to look at that as well. Next slide. So if you're unsure of how to start, just wanted to let you know that we do have technical assistance available for this grant. So you can always email the email address on this slide. We manage that email as part of the technical assistance for this opportunity, and we will get back to you with any questions you might have in a timely fashion to make sure you don't get stuck on anything. So please reach out if you have any questions or if you're needing help during this process. I also want to mention that we can't always respond to certain questions on a one-on-one basis due to fairness standards. But if you do send your questions to the email address, we will be sure to address them in our public FAQ document found on the ARPA website. That document is frequently updated and will contain answers to any questions you might have. Next slide. So if anybody has any questions, now is a great time to ask them. If you want to ask directly, you can utilize the Zoom Q&A box, or you can raise your hand and we will call on you. Thank you.
Sierra, we've got a couple questions coming into the Q&A about some of the slides that you just shared. Where would an agency find what is being requested for the good standing certificate? Our agency was not listed on the website provided. What should they do in that case?
Amanda, do you have any advice on that? I know, oh, she has her hand up.
Yeah, I'm happy to take that one. So a requirement for the state of Colorado for ARPA HCBS funding is that the applicants must submit a good status with their good standing with the state of Colorado. We have instructions to find that certificate on the website. But if your organization is not listed in there and there's no verification of a certificate of good standing or of fact, you are not eligible to apply. But feel free to send us an email if there's a unique circumstance that we can follow up on for you. I think that's a good question. So please follow up with our email and we'd love to take a look at your unique circumstance.
Amanda, we're getting quite a few questions about if the slides and presentation will be available afterwards. Do you want to share where folks will be able to find that information?
Yes, absolutely. The department has a website for all the ARPA grant opportunities, and this is ARPA 606. We will share the link to our website, which many of you may have already visited. We will upload a recording of today's presentation and the slides on the ARPA 606 website.
Amanda, we're getting quite a few questions about notice of eligibility. So we just went over the timeline. People have said they have applied, but have not heard back. So when do people expect to hear back from you about eligibility and if they have been accepted?
Absolutely, that's a great question. And we were hopeful to get responses to folks within 7 business days of submitting that intent to apply form. We have been delighted to see that we have had an overwhelming and unexpected response in a short amount of time. Sierra and I are going through and determining eligibility, cross-referencing the Medicaid billing database. However, we are thinking ahead strategically about this because you all should know that the full application, which you'll be getting a link if you're approved, you'll get an email from us with a link to the full application. That actually starts November 1st. So although we have a goal to respond within that 7 days, we're a little behind. We also just want to let you know that the soonest you would even get the link to apply would be November 1st, so that it's fair for everybody. If Sierra and I are able to determine quicker than we're kind of thinking now, we'll send you an email just to let you know, hey, you're approved. Be on the lookout for our email on November 1st. And then our commitment is after November 1st, we will stick to 5 to 7 business days so that folks submitting their intent to apply form after November 1st get a response as quickly as possible with that link to the full application. And by the way, the intent to apply form closes November 18th. So there's a little bit of overlap between intent to apply and the full application, but we do apologize for the delay in responding to you to determine eligibility. You can also review the grant guidelines to see and give your understanding how many members are served if you are eligible. But we thank you for your patience as we're trying to work through screening the intent to apply form.
Amanda, we do have a couple folks in the audience with their hands raised. So
Okay.
We're going to go ahead and unmute their lines to allow them to ask their questions if they still have them. So Anna, if you are still with us and wish to ask your question, you should be able to unmute your line and speak to us.
I was going to ask about the availability of the training. That has been answered. Thank you.
Great, thank you.
Thank you.
And then next in line is Christy. If you still have a question, Christy, you are able to unmute and speak.
Great, thank you so much. I am with an organization that is a community center board that provides case management services as well as is a PASA. And we seem to still be confused about whether or not the PASA part of the organization is eligible to apply this round. So as a PASA, we are an HCBS approved provider. We also happen to be a CCB and a case management agency.
Yeah, and that's a good question. We've actually gotten that question before and circled back with the department and received the following guidance that if you're a PASA, but you're also a CMA, we're still going to have you apply in the summer application period. This is because of the CMA redesign. And if your organization, let's say, does not engage with the redesign and stays or remains a PASA, you're eligible just like all other HCBS providers will be eligible in the summer as well. If you choose to continue on as a CMA with the redesign, you'll be eligible for an EHR upgrade or implementation only. And that's because the department will have other ARPA grant opportunities for you to take advantage of, in addition to the care and case management system tool, which will also be available to the CMAs under the redesign. We have some more information in the FAQs, and I will be putting some even more details around that in terms of eligibility in the summer in the FAQs here shortly. And I totally understand the confusion here, but this is really just at the direction of the department to make sure that we're focusing on how the CMA redesign may or may not impact dollars to digitize for the fall. So the short answer is your organization will be eligible in the summer.
Okay, so part of the issue is we're getting mixed messages when we ask this question. So we just got a response from Alexandra during the webinar here that organizations that are only CCB SEPs will be eligible in the spring, summer, and that any HCBS provider is eligible to apply this time around. So I understand it's a nuanced question, but like the answers are not entirely clear. So I would just want to be clear. We're an approved HCBS provider, but because we are also associated with a CCB, we are not eligible to apply this time around.
Yes, that sounds accurate. And I'll just share just the guidance. I'm reading it right here. If you're a case management agency, you're not eligible for the fall application period. If you are a direct HCBS service provider that are not providing case management services, you're eligible. If you're a CMA and provide direct HCBS services, you're not eligible for the fall. But when the summer comes around, it will open up to all of them. And again, this is hinges on the CMA redesign. And I'll add more to the FAQs too to help prevent confusion. And I really appreciate the question because I don't think you're alone in asking that question. And we understand how that could be confusing. So again, if you're a PASA or providing direct HCBS services and you're not providing case management at all through your organization, you're eligible. I hope that makes sense.
Amanda, I have some questions from the Q&A that I think would be great to answer live, and they're about allowable expenses. So you mentioned earlier about redesign programs. So we've had like 2 or 3 questions come in about the types of redesign programs you are thinking about. Can you elaborate more on what will be allowed?
Yeah, can you help me understand redesign programs?
Yes, and not to call out these people if they don't want to come off mute, but Christine Garcia and Dora Fernandez have both asked questions about redesign services. They want to elaborate.
Yeah, I would love to hear more from you guys about redesign services.
And while they're maybe coming off mute, can you share more about new software costs? So if we pay licensing costs based on new users, that is incremental, would those costs be covered?
Yeah, that's a great question as well. So ARPA HCBS funds in Colorado are meant to supplement new systems and not supplant existing systems, if that makes sense. So if your organization has an EHR that, let's say it's not up to 2015 interoperability standards, and you would like to upgrade that for your organization, that's included. However, if you have an existing system and you just want to expand your end users, that's not included. That would be supplanting existing systems. So think of like new systems. And it looks like Christine Garcia is wondering about how to come off mute. I'd recommend left-hand button where it says mute, unclick that. And we'll see if we can get your question.
I actually, yeah, Amanda, this is Nina. I actually have to give them permission. So it's most helpful if you can raise your hand, Christine or Dora, that way I can find you. And then there we go. Okay, Christine, go for it.
Okay, thank you. I think my question has been answered. I mostly, I was using that term because I didn't know the technical term that you said at the beginning, but I just was wondering about what type of things you guys were thinking of when you were talking about like digital, I can't remember what you called it, but what is the name of the thing? Digital
Transformation?
transformation. Thank you. That's what I was trying to ask. What falls under a digital transformation? And I guess the question is that, so we have an EHR that we're using now, and there's some things that they could do better within that EHR that would make our lives easier. If we partner with them, for example, and say, we want these things within the EHR to make our lives easier, and they say, okay, that's going to cost X amount of dollars, is that something that would fall into this type of what you guys are trying to support here?
Yeah, so I don't know that I can answer that question directly, but here's what the guidance tells us. So for ARPA HCBS funds in Colorado, the intention behind digital transformation, investing in digital tools and technology, is to expand, strengthen, and enhance the digital tools and technology used by HCBS and behavioral health providers. So if you have an EHR system that is in need of an enhancement or a feature enhancement to improve the services you're providing, that is eligible under this guidance.
Okay, that's very helpful. Thank you so much.
Welcome.
Amanda, and then,
oh, sorry, Nina.
no, that's okay. I just wanted to say we had some clarification from Dora in the Q&A that by design, they mean consulting assistance to design the technology a system, and then by implementation, they mean the actual installation and setup of the system.
Oh, okay, I'm understanding. Yeah, thank you for clarifying, Dora. You know, for that, I would say that almost falls under the domain of technical assistance, would be my thought. I think I'm hearing Dora say that, is it permitted with these grant dollars to hire like a consultant of sorts to come into my organization, look at my staff capacity, look at our technical readiness, and determine like an action plan, maybe like a project plan or a work plan, to then determine our course of action and also implement that project on behalf of your organization. And so that falls into technical assistance. And so that is an allowable expense under dollars to digitize up to $100,000 per organization. By the way, I do want to just let everybody know we're working on brainstorming one of the first deliverables for this grant opportunity. So once an organization receives and signs a grant award contract, they will be working with the department to submit a work plan to us. They're going to tell us, you're going to tell us how you intend to spend the funds, who's on point to be, you know, your user admin and timelines, things like that. So it is definitely relevant to start thinking about, you know, the strategy behind your digital transformation goals. and your overall project's work plan.
Amanda, I have two topics coming to the surface. The first one I think will be a little easier, and then we'll get to the next one. So can you say more about devices are subject to CMS approval? What criteria is CMS going to be using to approve these devices?
Yeah, that's a really great question. And we've been working with the department's ARPA leadership on this. CMS does view devices and equipment as capital expenditures. And there are very specific guidelines for how those capital expenditures, we have a decision tree on what would be allowed and wouldn't be allowed. So we're working with the department to get clarity on that. And we have submitted our request for devices and equipment to be included within the ARPA 606 grant program. We're waiting to hear back on that. We believe it's necessary for example, telehealth services or for EHRs. So we're waiting to hear back, and we wanted to just be out of an abundance of caution. We did stipulate in our grant guidelines that devices and equipment are still subject to federal authority approval. We're very optimistic that this will move forward, but in full transparency, just wanted to acknowledge the capital expenditure guidance.
Thanks, Amanda. So we've gotten quite a few questions about using different federal and state grants along with ARPA 606 and what will be eligible. Some people have mentioned they have already receiving funding from another ARPA grant. Does that make them ineligible for this grant? Can you just say more about using mixed grants for this?
Yes, and thank you for that question. That's a great one. So in the intent to apply form, there is a question that asks applicants, have you received an American Rescue Plan Act grant or applied for, or received any other grant similar to this one in the past 12 months? If the answer is yes, we are inviting you to share that information with us, but it may or may not disqualify you for the Dollars to Digitize grant program. We just need to understand and make sure that those who have received a similar grant are not also using the Dollars to Digitize, because that creates a conflict and an overlap in grant funds that's just not permitted with these funds. So if you have, please be transparent and share the details of that in the intent to apply form. And that's part of our initial eligibility screener, which is really the thinking behind that intent to apply form. So we'll review that, we'll go through it. And if we feel that that does not conflict with eligible expenses under Dollars to Digitize, you'll be conditionally approved to move forward to the full application.
Amanda, we have a couple folks with their hands raised, so we'll go back to some live questions. Alik, if you still have a question and would like to share, go for it. Just need to unmute your line.
It's Alec, by the way, but no worries.
Sorry, thank you. Thank you for correcting.
I have a question in and around EVV. As you guys probably know, in Colorado, the state has offered a free EVV product here by Sandata, and it is just EVV. It doesn't include none of the client-facing interfaces, not support for electronic billing or anything else. So I'm just wondering, for those folks who intended to apply and buy, a full agency management system, such an agency management system would typically include, the client side. It would include integrated billing and integrated payroll, as well as EVV. Now, you list EVV costs as excluded. I'm just wondering, how to, how your rules would apply to such an agency management system. Is that halfway clear? Sorry.
It is clear, and thank you for that question, Alec. So yes, so you're correct. EVV is not an allowable expense under Dollars to Digitize because it is already covered under Medicaid for reimbursement. So that's one of our guiding principles with what's allowed, what's not allowed. If this is already funded through another source like Medicaid, it doesn't make sense to include it in this grant, and that would definitely not be permitted anyway. However, I hear what you're saying in terms of the agency management system, or maybe a system that would integrate or complement EVV. Anything that's going to enhance, improve, and strengthen an organization's capacity to render services is included in the Dollars to Digitize grant. We cannot fund EVV, but if there is a system that works with EVV, that would be considered an enhanced electronic system, if that makes sense. But it cannot, no ARPA HCBS dollars can go towards EVV. I hope that provides some more clarity as you think about submitting your application.
Yes, a little bit. My question to your point is simply this. Typically, you know, when you try to buy the system, you get one price. There's one implementation fee. You know, I understand if there are separate EVV costs, those would not be eligible. But, you know, if I wanted to apply for that, with the accent being on the integrated billing, that helps me to get rid of paper timesheets and all that, do I have to then ask the provider for, you know, a separate billing just for that piece? Is that how it would go? Or, you know, any guidance you can give would be helpful. Thank you.
Yeah, I like what you have suggested. I think that makes sense, but yeah, EVV cannot be included in the request. It will be denied. And so I would definitely work with your vendor if you're working with SanData. Work with them, let them know about the grant opportunity. It's very clear on our website and also on our guidelines that EVV is not supported. So I would encourage you to work with your vendor to see what can be accomplished if you need to separate that out. I would encourage you to brainstorm with them and just stay within the guidelines stipulated in the grant program guidelines on our website.
Thank
Thank
you.
you for that question.
Amanda, we have one more hand raised, so we'll get to Gail. If you would like to ask your question, we'll give you permission to speak. And then we also did get a request in the Q&A to see the poll results again for the expenses that folks were interested in. So I'm just going to go ahead and share those results with everyone while we're talking so that the audience can see those again. We also got a question about re-showing the contact information. So we'll move to that slide as well. But Gail, if you are ready to share your question, go for it.
Yeah, thank you. I think you answered it around, you know, the blending of federal funds around this. And so I'll just submit it in that way, my letter of intent. So thank you.
Great. Thanks, Gail. And thanks, Nina, for putting up the poll again. And the contact info is on the screen as well. So we have about 6 or 7 minutes left in our webinar, open to any other questions you might have.
Amanda, we do have an eligibility question in the Q&A that I can highlight. As an FQHC, our EHR spans behavioral health and medical and integrates with our dental EHR, Dentrix. Would any of these factors preclude us from being eligible?
That's a really great question as well. First of all, the Dollars to Digitize is not covering dental. And also for the FQHCs, we are also inviting them to apply for our summer application period. Why? Because for the fall application period, we were not clear on which FQHCs, federally qualified health centers, had already received funding from the Meaningful Use High-Tech EHR Incentive Program. And so that has been on our radar to put a strategy around how do we verify whether those entities received funding or not. So for federally qualified health centers, those, just like the CMAs, are invited to apply for the summer application period. And maybe it would be helpful to recap. So for the fall application period is somewhat narrow in its scope. It's really designed to have maximum impact and to address the most critical need. Not that all needs aren't important and critical in our minds, but we're really, the fall application period is somewhat smaller in contrast to the larger application period launching this summer will be inclusive of the CMAs, HCBS, behavioral health providers. We're even open to exploring whether we still want to move forward with 30 or more Health First Colorado members for behavioral health providers. We may broaden the eligibility standards. So the summer RFA period, request for application period, is really going to be a lot broader in terms of eligibility too. We do want to acknowledge that the fall application period somewhat has a narrow scope in terms of eligibility.
Amanda, do we want to share a little more information about how folks will be able to hear about the summer RFA?
Absolutely. We will have a ton of updates on our website. We will also be doing another outreach campaign via newsletters, emails. We'll send out flyers. We will have just like we did for the fall application period, as soon as we start formulating the guidelines and expanding eligibility requirements, we're going to make sure that the same channels that we got the word out about the fall application period goes out for the summer application period well in advance. And we're looking at the May timeframe for that to launch, potentially later. We're trying to align with the CMA redesign as well. So we will definitely keep you posted, and you're welcome to email us at gov.arpa.ohi@state.co.us and check in. And then we'll keep you posted on our website and we'll go from there. But that's a great question. And we're really looking forward to this already, even though the summer sounds so far away, it's actually just right around the corner. I think we have a few hands raised potentially.
Yes, thanks, Amanda. We have Brian. Brian, if you'd like to share your question, you can unmute your line.
Can you hear me okay now?
We can, yes.
Okay, sorry about that. It's a new system here. I'd just like to make a point, Amanda, about I'm actually from the IT industry and came into behavioral health care by marriage a number of years ago, and I think something worth considering here is that this industry is made up of people who are healthcare professionals, social workers, psychologists, counselors, and there's very little technical expertise intrinsic within the industry itself, I found, compared to many other industries, even things like community mental health centers and medical practice groups. So I think the questions has come up several times. What about consultants to help us is really important, not only, of course, to just kind of help make things work and navigate, but also to even advise us on even what's available. The number of products and services that are available is not known. So I would suggest maybe forming a stakeholders group, so there's so many people that have the same kinds of things could use some information on what's available and what it would take to convert over to that. Just some insight into what's available, technically speaking, as opposed to, we got a great idea, how do we fund it? I think there's a lot more in the former group than we realize.
Thank you for that, Brian. You are absolutely right. And our survey reiterates that point, that some folks just have a challenge with some of the technical resource capacity. And I know we're just about at time, but I do want to acknowledge that if you visit our ARPA 606 website, we do have a sample technical readiness assessment, which we encourage all applicants to take this assessment. It talks about staff capacity, what your infrastructure looks like, what are you interested in terms of technology. We also have a tips for selecting a vendor guide, just some general best practices and definitions and links for picking a vendor. If you're starting from scratch and you're not sure where to start in your digital transformation journey, head on over to our website. We try to put together as many resources as we can on the website. In addition to that, we are planning ahead for technical assistance above and beyond what the vendor's providing, what your grant request requires. We want to have someone on our team hosting webinars, hosting lunch and learns, going out to the community as a lending hand. And for those who demonstrate need, those providers, we want to come alongside you and ensure success by adding additional technical assistance support available to you. So we do hope to do that as well. We definitely acknowledge the need and thank you for that point about the consultants and additional help. And with that, I just want to say thank you all for your great questions. We're doing our best to answer those and we'll continue to do so in our FAQs document. Please reach out to us. We'd love to hear from you. Let us know if you have other questions, and just thank you so much for participating in our webinar today. And looking forward to seeing the applications come in. Take care, everyone. Thank you.